Hi all, welcome to another video of NS Pharma. Today we will see important multiple choice questions from the Macrolide, that is Pharmacology chapter, Macrolide Lincosamide Glycopeptide and Urinary Antiseptic, all these. Macrolide antibiotic, Lincosamide antibiotic, Glycopeptide antibiotic and also some urinary antiseptics. From this chapter, we will discuss some important multiple choice question. The first question of the video: select the antibiotic which inhibit the drug metabolizing isoenzyme cytochrome P3A4, resulting in potentially fatal drug interaction with terfenadine. Antibiotic which inhibits metabolizing enzyme and also it will causes fatal drug interaction with terfenadine. Option A, Azithromycin. Option B, Clindamycin. Option C, Gentamicin. Option D, Vancomycin. The correct answer for this question is Azithromycin. This one we already discussed in the the introduction chapter, the first chapter of the pharmacology. That is some general aspects of pharmacology. In that we discussed the enzyme inhibitors, metabolizing enzyme inhibitor. We discussed this one also, one idea regarding this for remembering the names of the drugs which inhibits the metabolizing enzymes. It was vitamin K can cause enzyme inhibition. That was the code. I think you remember that one in the general pharmacology. In the introduction we just discussed that one. In that you can see here we represent valproate. This is valproate. I am right now discussing the metabolizing this enzyme inhibition of drug metabolism by inhibiting the metabolizing enzyme. The drugs which inhibit the drug metabolism of one, valproate. K represents ketoconazole. C represents cimetidine. Again C represents ciprofloxacin. Then E represents erythromycin. I represent INH. Okay, with valproate, ketoconazole, cimetidine, ciprofloxacin, erythromycin, INH. This is the question here. The enzyme is the antibiotic which inhibit the drug metabolizing isoenzyme CYP3A4, resulting in potentially fatal drug interaction with terfenadine, that is erythromycin. The second question: the following is true of clarithromycin except. Option A, it produces less gastric irritation and pain than erythromycin. Option B, it is most active macrolide antibiotic against Helicobacter pylori. Option C, it does not interact with terfenadine or cisapride to cause cardiac arrhythmia. That was here, erythromycin causes cardiac arrhythmia by reacting with terfenadine. In the first question that was this question was saying here it does not the advantages of clarithromycin. It does not interact with terfenadine or cisapride to cause cardiac arrhythmia. Option D, it exhibits dose dependent elimination kinetics. Question was: the following is true about clarithromycin except. The correct answer for this question is option C. It does not interact with terfenadine or cisapride to cause cardiac arrhythmia. Next question: clarithromycin also causes interact with terfenadine. Next question number 3. Select the macrolide antibiotic that can be given once daily for 3 days for empirical treatment of ear, nose, throat, respiratory and genital infection. This is a 3 days dose which is the medicine, and also daily once daily dose. Option A, erythromycin. Option B, azithromycin. Option C, roxithromycin. Option D, clarithromycin. The correct answer is azithromycin. 3 days course once daily, that is azithromycin 500 mg. OD for 3 days. That is the 3 days course daily once. Now we will move to the next question. Question number 4. Features of clindamycin include the following. Option A, it is primarily active against aerobic gram-negative bacilli. Option B, it can be used topically to treat infected acne vulgaris. Option C, it is not absorbed orally. Option D, it is used to treat pseudomembranous enterocolitis. Clindamycin, we know that clindamycin is available in the lotion form, and also it's available in the gel form in the market, which is used for the treatment of acne vulgaris. The correct answer is option B. It can be used topically to treat infected acne vulgaris. Now the 5th question. The drug of choice for the treatment of methicillin resistant Staphylococcus aureus infection is. The drug of choice for the treatment of methicillin resistant Staphylococcus aureus infection. Option A, cloxacillin. Option B, vancomycin. Option C, erythromycin. Option D, amikacin. The correct answer for this question is vancomycin. Methicillin resistant, the treatment of drug of choice for the treatment of methicillin resistant Staphylococcus aureus. Vancomycin is the drug of choice. Question number 6. The following is true of vancomycin except it is a bactericidal antibiotic active primarily against gram-positive bacteria. The question is true of vancomycin except it is bactericidal antibiotic active primarily against gram-positive bacteria. Option B, it acts by inhibiting bacterial protein synthesis. Option C, it's an alternative to penicillin for the enterococcal endocarditis. Option D, it can cause deafness as a dose-related toxicity. This question we already discussed in the general introduction to the antimicrobial agents. Vancomycin is coming under classification. They are classified based on the mechanism of action. The mechanism of action of vancomycin is like penicillin. It's cell wall synthesis inhibition. The action is through cell wall synthesis inhibition. So here the wrong answer, that is the question. The following is true about vancomycin except, that means the false statement against vancomycin is option B, it acts by inhibiting bacterial protein synthesis. Actually the action is through cell wall synthesis inhibition. Now the 7th question, Rudman syndrome. Rudman syndrome has been associated with rapid IV injection of the following antibiotic. Options are vancomycin, option B clindamycin, option C sulfapurazone, option D piperacillin. The correct answer for this question is vancomycin. Rudman syndrome is caused by the rapid IV injection of the vancomycin. Question number 8. Select the antimicrobial agent that can be used to treat with both methicillin resistant and also vancomycin resistant Staphylococcus aureus infection. In the previous one of the question was methicillin, the drug of choice in case of methicillin resistant Staphylococcus aureus was vancomycin. Here the infection is actually resistant to methicillin as well as vancomycin. Staphylococcus aureus infection which is resistant to methicillin and also vancomycin, then the drug of choice for this infection is option A Clarithromycin, option B Clindamycin, option C linezolid, option D Lincomycin. The correct answer is linezolid. Linezolid is used for the treatment of the infection caused by Staphylococcus aureus, which is resistant to methicillin as well as vancomycin. Now the ninth question. Choose the correct statement about methenamine or hexamine. The correct statement about methenamine. It acts by getting converted into mantelic acid in the urinary tract. Option B, it releases formaldehyde in acidic urine, which in turn kills the bacteria. Option C, it is highly effective in acute urinary tract infection. Option D, it is preferred urinary antiseptic in patient with liver disease. The correct statement about methenamine. The correct answer for this question, option B, it releases formaldehyde in acidic urine, which in turn kills the bacteria. This formaldehyde formed from the methenamine will kill the bacteria. Now the 10th question, acidic urine augment the antibacterial action of. Acidic urine augment the antibacterial action of the following drug. Options are ciprofloxacin, option B cotrimoxazole, gentamicin, nitrofurantoin. The correct answer for this question is nitrofurantoin. Acidic urine augments the antibacterial action of the nitrofurantoin. Thank you guys for watching this video. Hopefully you enjoyed this video, and if you didn't subscribe until now my channel, please subscribe the channel and also press the bell button so that you will get the notification whenever I upload new videos. Thank you.